Alrighty, this is the Humana Medicare Advantage 2026 insurance review for Central Texas. I'm going to go over two plans. Gold Plus HMO and full access PPO. So let's get this started. This is, let me share my screen. This is Humana website. You can go to humana.com, plug in your zip code. This is what's being offered. Definitely have some changes. Okay, so yeah, this will do a nice little comparison for the PPOs anyhow. Alrighty, let's go over the Gold Plus HMO, what the changes are for 2026. See that. Alrighty, so it's the Humana Gold Plus. Here's the service area of the counties. There you are. Okie dokie. Right, monthly premium remains the same at $0. You have a Part B premium reduction by $1 versus $2. This year, there was no pharmacy deductible. There is definitely one for 26. It only applies to tiers 4 and 5. Maximum out of pocket's the same. So no medical deductible. Hospital stay is the same, $275 for days 1 through 6. All of this is the same. Surgery services is at an ambulatory center is lowered. It was $210. It's going to be $175 next year. So versus outpatient hospital like St. David Surgical Center, a dedicated facility for surgery, right? That's what an ambulatory surgery center is. Primary $0. Specialist went down from 30 to 20 for next year. You should get all your screenings and your preventatives for $0. Okay. Yeah, urgent care is $5 less next year. Advanced imaging. Okay. 200, that's the same. Freestanding. Lower. 300 for next year. It was 325 in outpatient hospital. These are the same. That's all the same for x-rays. It looks like this $50 copay at urgent care is what's lower. That's the main difference on those. This is also cheaper by $10 on both. It was $210 and $260. Nuclear medicine. And that's all the same. Hearing aid benefit remains the same. So does the dental, 2,000 annual max. Vision has increased to 150 to 250 for a plus provider. I'd have to look that up for you to utilize that benefit. This remains the same. So skilled nursing is a $10 copay for first 20 days. That's just another name for rehab. Ground ambulance is increased from 315 to 335. That's all the same. 20% out of your pocket for Part B drugs. So the drug deductible looks like the major change. And again, it only applies for tiers 4 and 5. So we might need to do a review of your prescriptions. Yeah, okay, that's all the same, your copays for your prescriptions. Let's look at added benefits. Don't forget your max for your prescriptions. If your co-insurances or copays reach 2,100, you don't pay for your prescriptions for that year. That's deemed by Medicare. Original Medicare costs increase every year. Last year, the true out-of-pocket cost for drugs was $2,000. They've increased it to $2,100. And then also just note your Part B premium also goes up. Why is this not working? It was 180. There you go. It's going to increase to 206.50 for most. Remember, that's income bracket based, but most Americans fall within this income bracket. So it was at like 185, something like that. It's going up to 206.50. So watch any communication from Social Security office and your monthly stipend. Yeah. Okay. Where was I? Yeah. Acupuncture is 20 next year versus 30. Chiropractic is 15 versus 20. Podiatry is 20 versus 30. Remember, this is for next year, 26. That's all the same. Durable medical equipment. Your therapies, okay. They're about the same outside of this 15. No, that 15, that's same. Yeah, that's all the same. Any kind of therapy you get. Alrighty. You did not get an over-the-counter benefit this year. You will get one next year, $75 over-the-counter quarterly allowance. Approved through the over-the-counter mail order vendor. That's Centerwell. That's who that's with Humana. And you get silver sneakers. Okay, so again, you get really the gist of it. You get a little bit lower copays just across the board. $75 over-the-counter allowance. Everything else pretty much remains the same, except for the drug deductible of $615 that applies to tier 4s and 5s. Alrighty, that's Gold Plus HMO. Let's get into the local PPO. I know a lot of you guys are on that as well. All right, so this is the full access. The plan number is changing. Bastrop, Burnett, Hayes, McLennan, Travis, and Williamson. Same. Okie dokie. Monthly plan premium will remain the same at $0. Part B reduction of $1 versus $2. There is a medical deductible that has changed. You did not have one. You will have one for 2026. $300 combined, meaning for in and out of network. So before you see any doctor, you're going to pay $300. Yeah. What else? Okay, the pharmacy deductible was $345 for tiers 3, 4, and 5 for this year. It's gone up to $420. And the max out of pocket for in and out of network is the same. Inpatient hospital stay remains the same, $350 for days 1 through 6. This is all the same as this year. Okay. Specialist remains the same, so your primary $0, specialist $40. All your preventatives for $0. Urgent C has gone up $5 from 110 to 115. Telehealth is 40 versus 45. Okay. This one has dropped. The outpatient hospital was $325 for 2025. It's going to be $300. When it comes to diagnostics, MRI, PET scan, CAT scan, all that's about the same, except for this one is lower at outpatient hospital. Okay. X-rays are the same. Yeah. Okay, that's the same as well. Diagnostic tests and procedures. That's the same. Nuclear medicine, it's gone down. It was $250 at a freestanding. It's going to be $200, and the outpatient hospital did go up by $110. So it was $250. It's going to be $360 for nuclear medicine at an outpatient hospital. Hearing aid benefit remains the same. Dental's gone down by half. Was $3,000. It's going to be $1,500 for next year. And your eyewear allotment has gone down from $300 to $200. Depends on the provider you get your eyewears from. If they're a plus provider, I'd have to look that up. Then you get $300. This is all mental health. It all remains the same. Okay, so ground ambulance increased from $315 to $335. All of this remains the same. 20% out of pocket. Durable medical equipment, Part D drugs. Alrighty. So again, to reiterate, on the prescription drug portion of your policy, your pharmacy deductible has increased in 2026 to $420 versus $345 for tiers 3, 4, and 5. So you might want to do a review with me regarding your out-of-pocket costs for prescriptions. Don't forget that if you end up reaching 2,100, I just said that a few minutes ago for the HMO, whatever comes out of your pocket, your copays, co-insurances, if you reach 2,100, then nothing should come out of your pocket the rest of the year. That 420 deductible has to be met. That will be paid at the pharmacy. Okay, all of that's the same. These are the same 100 therapies, copays. Okay, and added benefits. You still will receive a $50 quarterly allowance. You will have a national network. And you will get silver sneakers. All right, so the gist is pharmacy deductible increasing to $420 for tiers 3, 4, and 5. Reduction in dental benefits from $3,000 per year to $1,500 per year. Same quarterly allowance. All the copays are basically the same. Still a $0 monthly premium. And of course, the medical deductible of $300. That's the other big one on this one. Yeah, right here. Okay, so that is the full access PPO. I am going to upload this recording to my website for further review. Let's just take a look at this policy here, the Humana Essentials Plus Give Back PPO versus the Humana Full Access PPO. So both $0 premiums. We're looking at this versus the full access, these two columns. Medical deductible is lower on the full access. It's $425 on the give back. Prescription deductible is lower. It's $350 versus $420 on the full access. Max out of pocket's higher on the give back, and you get a $1 reduction on your Part B premium, where on the Essentials Plus give back, you get a $90. Really, it's really about doing the math, if that's even going to benefit you. So I'll be happy to review that with you and crunch numbers. You're still going to get $1,500 allowance, so that's the same. You get a little bit lower on the eyewear allowance. Okay. So the copays are not the same for in and out of network services, which they are on the full access. You do not get an over-the-counter catalog because they're giving you a $90 reduction. So if they give in one area, they're going to take away in another. That's always the trend. Yeah. Still, yeah. So you still get silver sneakers. Yep. So on the Essentials Give Back, you're out of network. This is out of network. It's going to be 30% across the board out of pocket costs versus on the full access, you get the same copays. We're out of network. Yeah, it would really only benefit you if this $90 a month is something that would help you out. Okay, so that's quite a bit of money. 90 times 12. It's $1,000 extra a month, but then you've got an increase in deductible. I don't know. That would be something we would need to discuss if that interests you. Okay, so that's it. That's what's being offered in Central Texas. Yeah, one more thing, and that's it really. If you want to look at other carriers, you can. You want to book an appointment with me to review your policy, please do. Go to my website, book consultation, pick either an hour, which is the middle one, or 30 minutes. If I need to re-enroll you, you might not have to re-enroll. Not sure. Also, if you hover over more and go to pre-recorded educational member meetings, I will be uploading these recorded meetings for your view. So you can take a look at like Aetna, Central Texas versus what I just went over for PPO for Humana. I won't be selling United Healthcare PPOs. They're not commissionable. I will be selling 0 Blue Cross Blue Shield policies. They're not commissionable. So please check with me first if you're interested in moving from one carrier to the next. Ready. Well, that was easy. Thanks for stopping by. Catch you later. Thanks.